Alright, so I am officially making this video to basically sound off the alarms. This is what I'm doing here. Alright, because COVID-19, the novel coronavirus, which is basically a breakout now. I was actually reporting on it when it had first came out, then I kind of stopped covering it as it kept going. And, towards the middle of the time, I was kind of like, it's blown out of proportion. It's not a big deal. Not that much stuff is going to happen. It's not all that big of a deal. Don't get, panicked. Now I've completely changed my tune, and I'm going to break down to you in depth as to why I'm changing my mind. It is time to pull the fire alarm. We are going to be dealing with the global pandemic. Every nation in the world is going to be dealing with this, okay? And especially here in the United States, this is going to be really, really bad. So we've got a lot of issues here. So first off, right, Mike Pence has now been deemed the head of dealing with this problem. Mike Pence is somebody who doesn't believe in climate change, doesn't believe in evolution, doesn't believe in science. And as you see here, it says when Mike Pence was governor of Indiana, an HIV outbreak hit one of the state's poorest counties. A study by the Yale School of Public Health found that had Indiana acted earlier, the number of people affected could have been reduced by more than 90%. So clearly this guy doesn't know how to contain outbreaks, and he's not an expert on this issue in any way, shape, or form. Now, that leads me to another point. Well, let's finish out that point, right? Mike Pence, he's a religious lunatic, doesn't believe in science, not the guy you want fighting COVID, right? But in addition to that whole thing, Donald Trump has fired a lot of these people in these science agencies like the CDC and in these areas. And we saw that a lot with, remember when he made up an area that the flood was going to hit, I think it was Alabama or something like that, and it wasn't actually projected to hit there, and he literally wrote it in with a marker, and then he threatened people in the agency, you're going to be fired if you come out and correct me on this. It reminds me of Stalin. Remember Stalin during the Great Purge, when he was basically just started killing like his military advisors and experts, and then he was getting spanked when the Nazis invaded? It's similar to that in this scenario, right? He would fire all these experts, and then you don't have competent people. For fuck's sake, a lot of your goddamn committee members, your cabinet members are acting members. They're not even real people. They're just acting. And so it's like you don't even have real appointees. They're just acting officials. And it's like, wow, you are clearly not prepared for this. And also there's a report basically that this guy who went to, I believe, is the UC Davis Medical Center, so it's awesome that it's in NorCal, so your boy is definitely fucked. But he was actually, I guess UC Davis Medical Center was like, hey, he needs to be checked for COVID. And then the CDC was like, nah, he doesn't fit the bill because he's not from China, he didn't come from China or wherever. He didn't have any sort of link like that. And so it turns out the guy was positive, but they had let him go, and so he was just free roaming wherever he wanted. And so you've got this guy now giving it to a bunch of people, and as you guys are all aware, you can pass on COVID without symptoms even showing. So the incubation period could still be going on, and you could spread it to somebody without even knowing that you have it, which is really, really dangerous, obviously. So what that situation in that case exhibits is that our agencies and our institutions have been eroded so much under Donald Trump that basically there's no competency left in any of these agencies like the CDC, for example. So the CDC has been neutered, their nuts have been cut off, and so they don't have anything. And then also, the tests for COVID are extremely expensive. And then also, if you are somebody who, how do you know you have the coronavirus? How would you know? There's not really any serious distinguishable symptoms, and that's the problem with a lot of these things. They're all virtually the same. Well, yeah, you get a fever, you get this, you get that, you have a cough, whatever. It's all the same shit, right? So it's tough to tell. And then the tests are really expensive. I think it was $1,700 or $3,200 for a single test. And then it's how many people are going to come up as false? How many people are going to be like, oh yeah, I have it. They think they have it, but nah, it turns out they don't have it. And then it's oh, do I really believe this person has it? And that's where it just becomes chaos right there. And then you start talking about the logistics of the way our society is here in the United States, right? People don't have paid sick leave and they don't have health care. If you don't have health insurance and you don't have paid sick leave, you're sick, you go to work, and you get other people sick because you don't have paid sick leave or health care to go to a hospital or get a doctor's appointment with your PCP. or to go to, urgent care or whatever. And in this scenario, you're talking about having to get CDC tests, which are very expensive for COVID. This is literally like a movie plot line. I was saying, this should be a plot line for a movie. This is how insane it is. You're talking about the incompetency has never been matched in all of history in terms of our government right now in dealing with this, what's going to be a pandemic, and dealing with the problem in the United States. You've got incompetency in the government agencies beyond Mike Pence, like the CDC, because all the experts have been fired and let go because Donald Trump just wanted yes men. And then you've got a virus that spreads without symptoms even showing. So it's spreading before symptoms even exhibit themselves. And then after that, you've also got people without paid sick leave and health insurance, and so there's no way to check. The COVID tests are extremely expensive. And then also, I was just caught a story right now that basically someone with COVID who gets COVID can become reinfected again. Now, I don't know if those people can become infectious in terms of, like, are they contagious to others? I don't know. I think that answer may be a no, but wow. I mean, this is a fucking disaster. So I'm talking, like, pull the fire alarm. I'm telling you right now. I'm calling it right now. Watch this video later. It's going to be a massive, massive problem. Huge problem. Also, China lies about everything. They're fucking authoritarian dipshits who are disgusting government people. So, they are not to be trusted with literally anything. Fuck them. And then here in the U.S., Donald Trump also has a vested interest in basically having it low, right? So we're screwed big time. Seriously, pull the fire alarm. Basically, even if it has like a 2% mortality rate or whatever it is, that's still a lot of people that are going to die. And people who are susceptible to it are old folks and young kids, I think, or young folks or whatever. So, scary stuff going on, man. But it's going to become a huge problem. It's not looking good, dude. So trust me, it's now a serious problem. And trust me, if you're a skeptic, I was a skeptic like you. But once you look at all the facts, it's impossible to deny. It really is impossible. It's literally impossible to deny at this point.